I'm Brooke, Doctor of Physical Therapy at Cure for the Kids Foundation. So one of the great things about being here is we are able to spend so much one-on-one time with the children rather than being thrown between 3 or 4 patients at a time. We're just focusing on that one person. So typically we only see one patient every half an hour to an hour, depending on how much time that specific person needs with us. So a normal day here, we're spending half an hour to an hour with a patient, doing manual therapy or exercise, depending on the needs of each patient, it can vary. So I met Dr. Ikeda working at Summerlin Hospital, so I was one of the physical therapists in the NICU and pediatric oncology. He knew that I also had my own clinic outside of working at the hospital, so because of my previous experience of starting my own program in the past, he had just asked if I had any interest in working here at the clinic instead of being just at the hospital and there, and it was a perfect mix of everything that I'm interested in and have a passion for, and it's been a very fun ride. I'm so excited. I would love to have a program where we are working not only with, especially our older kids. Our younger kids do an amazing job functionally coming back from a lot of stuff through chemo or treatment, but especially for our 12 to older teenagers, I would love to have a program where a lot of them, while they're going through chemo, are on an exercise protocol. We've even talked about even having them do something low intensity, like being on a seated bike while they're actually receiving chemotherapy. And so a couple years down the road, I want to see more of a proactive approach and preventative approach to a lot of this rather than a reactive approach. So instead of us treating these kids once they're already getting neuropathy, what are the things we can do? Hey, we know this kid's going to need chemo, we know they're going to need this protocol. What do we know from our research and our experience that we can do to put them on so they don't even have those problems or those issues that they have to deal with? Obviously, there are certain things we'll always have to kind of fight against when we're working with chemo, but I want to see in a couple years from now a very strong research base and a very strong team where we know and trust each other to have in place that as soon as a child has a diagnosis, this is the protocol we're going to do to prevent all of these issues from even happening.